and welcome back. Similar to what we saw in New York and Michigan, older COVID patients were denied intensive care during height of crisis in the UK, as fewer as it is claimed over 60s were not given potentially life-saving treatment during first wave in bid to stop the NHS being overrun. And the idea was, of course, from Professor Neil Ferguson's outlandish predictions that the NHS would be overrun and we'd have far too many people going into the millions that we would not have nearly enough capacity, in which case you then have to prioritise who gets the care and who does not. And as with always happens with socialised healthcare, you do have death panels, which is to decide that your life is worth saving, whereas yours is not. That is just a fact of the matter, because it cannot be based on the individual's insurance or what they're willing to pay. Instead, it is decided on the government deciding if your life is worth saving or not. And the way that they had decided to try and implement this was with a triage tool, which scored patients on age, frailty and conditions, which was used by some doctors, say the Sunday Times. However, the NHS chiefs say the tool was considered at the start of the pandemic, but never finished and never officially published. It was published once on their website, but it was retracted as apparently it was an error. But, of course, by that time the logo had already been used in conjunction with it, and it was already being used to dismiss the people in most need of the ICU care from getting it. So the tool for working out who would receive intensive care put those over 80 immediately into exclusion zone, and put those over the age of 65 almost definitely into the exclusion zone. According to Sunday Times, the tool was used by doctors in hospitals in Manchester, Liverpool and London. Worst hit areas. So, they say, older coronavirus patients were denied ICU treatment on the NHS during the height of the COVID-19 pandemic. It has been claimed those aged over 18 and some in younger groups, such as the over 60s, were not given potentially life-saving treatment because health chiefs were concerned the NHS would be overrun, according to reports. And we know that this was never actually the case, that we were not overrun. The NHS was not going to be a problem any more than normal, of course, as it does tend to be a little bit overrun. But actually, the NHS chiefs say that even at the height of the pandemic, only 42% of NHS's ventilator beds were being used. And also, the tiered systems for how much help people needed wasn't very well run either, in that people who needed less support were still being helped by ICU staff and were not being used as they would be needed for actual ICU intervention. As these graphs go on to show, like here for example, is the NHS anywhere near capacity, that at the peak of the crisis in Britain, only a quarter of all beds were occupied by virus patients. On April 7th, 26.5% of the 60,206 people in England's hospitals were being treated for coronavirus, the highest proportion on record, which was quite a while back before we really knew what was happening and if it was a concern. Of course, you do see excess hospital deaths here, as we weren't sure what was going on, and also from people who then were not going to hospital as should have done because they were too concerned about the coof. Similarly, when they were scared about superbugs like methicillin-resistant Staphylococcus aureus, MRSA, that you're going to get more sick going to hospital than you would by staying out and just trying to recover on your own. Maybe do an extended period of fasting so that your body can complete its cell autophagy and therefore be able to restore itself, similar to how some cancers go into remission if doing extended periods of fasting. But please, this is not medical advice, so seek medical supervision if you wish to go down that route. So, as part of the investigation, the paper claims some GPs were asked to identify frail and elderly patients who would be left at home, even if they needed hospital treatment due to complications from COVID-19. It also claims NHS England issued guidance about groups of patients who should not ordinarily be taken to hospital without the green light from a senior doctor. These groups include all care home residents. And of course, if they're in a care home and they do have the coof, then they also most likely have their comorbidities. They are in the highest risk group. They are then infecting the other people inside the care homes, and this is why most of the deaths happen in the care homes. Even though, of course, as I said before, in the last month, the coof was not even in the top 10 for most deaths. this was all brought about by, as I say, Professor Neil Ferguson's outlandish predictions for how bad it would be, especially given his track record being so appalling, whether that be foot-and-mouth disease, mad cow disease, swine flu, bird flu, any of those where he was out by a matter of somewhere between 10,000 and a million. That's how bad his predictions were, and yet we still followed that. That's why Sweden decided to not, and in doing so, sure, they had an initial peak, but since then it's died down, and they're getting on just fine without having to worry about a second wave like we're doing here. The second wave over here, in fact, being so bad that there are concerns that a tier 3 system, instead of going from 1 through 3, will now need a 4th tier, which will be much more reminiscent of what we had during the whole national lockdown just a few months ago, which, again, doesn't seem to have helped much, seeing as soon as it's lifted, then you get a spike again. So we can't keep doing this on-off, because of course then you don't get enough time to get any serious amount of work done, and also then your job's in jeopardy, and there's so much economic uncertainty that companies and employers don't know what they're doing, and if their business is going to be a worthwhile venture, given that it could suddenly be thrown underwater again with very little notice, without anything they can do to prevent that, especially in the hospitality sector, that they're just not going to want to take the risk, whether they're the business owners or the investors, to try and get the business to work in the first place, in which case all will be left are the ones which have big enough clout to then be demanding bailouts from government so that they won't go under because they're too big to fail, and they're the only ones that will be left. And meanwhile, you'll have companies like Amazon just cleaning up when it comes to getting things that are deemed non-essential, but Amazon will still work, and of course it will be shipped out to you, and that is the main company that is going to be growing after this, as we see the strategies used by businesses change in order to accommodate from government regulation. And that is the ever ongoing challenge of an entrepreneur, not only to find what problem there is that they have a solution for, but also then to try and get around the government regulation in order to ensure that it is a profitable and law-abiding endeavour. And just to finish up, when it comes to are the beds actually used, given that there were so many deaths, you would have thought, well, hey, we're going to be over capacity and we're going to have to be prioritising patients. Sure, if you're in here, lucky you, we're not going to get rid of you, but once you're gone, we're going to replace you with someone that's basically on the waiting list because we're so inundated. However, it comes as other reports suggest that the largest Nightingale hospital at London's Excel Centre will need to undergo work before it can be used once more. The field hospital, one of 7 built across the UK to deal with an influx of COVID patients during the first wave, contained 500 intensive care beds, but cared for 51 patients. It was put into standby in May after hospital admissions began to drop, but the government has stated the field hospital will now start to reopen, with Manchester already reopened as case numbers begin to rise again. However, according to the Telegraph, the NHS has admitted no work has been done on London Nightingale's hospital since it was put on standby. So as expected, Dr. Enish Palmer, a specialist registrar in anaesthetics who chairs the Doctors Association, accused the government of sitting on their hands. He said, "You tend to have more patients that are not intubated and ventilated than using other therapies. From a staffing point of view, it would also make sense to have it as a step-down facility, so you're not then required to staff it with intensive care doctors and nurses who are already in short supply," as stated earlier. But that's about it for now. So as always, let me know what you guys think down below. If you think, well, hey, if people need hospital help, then they should be going there. First in, first served. That's the idea. And if you then run out of spaces after then, when you do have that waiting list, then of course you're going to prioritise people as spaces become available. But until then, you should leave it out. Or do you think, actually, no, if you're already in this high risk, then there's nothing that can be done for you anyway, so we're not going to waste our money, our time and your time on you, and instead we're going to keep those beds open and waiting until somebody who can be helped comes along that we're far more confident that we can help. And in the meantime, you're going to be quarantined in an old folks home because that's where you're from and that's where you're going to stay. Either way, let me know down below. Always intrigued to hear what you have to say. And as always, until next time, like, comment, share, subscribe, all the good stuff, and have a good one.